Good morning, good afternoon, and good evening to all of you from Philippines. This is Dr. Shaji Kudier from um, Shaji Varghese Kudier, welcoming you all to the 292nd session of International Forum for Promoting Homeopathy. Before we proceed, I would like to have 1 minute silent prayer for the success of the vision and missions of IOPH and also for the successful conveyance of the Zoom session today. So let us have 1 minute silent prayer. Thank you. So for the information of those who join us for the first session, International Forum for Promoting Homeopathy is an organization formed by a group of homeopathy lovers, doctors and students at the time of pandemic when the whole world remained still, unable to tackle the problem, and homeopathy emerged as the best prevention and treatment option for this viral infection. But unfortunately, the world at large remain unaware about these possibilities of homeopathic medicine, and it still remains ignored by the world at large, political leaders and healthcare authorities around the world. So it is the responsibility of every responsible homeopathy doctor and those who understand homeopathy is to make the world understand and help the world realize the potentials of this wonderful system of medicine so that humanity at large will be utilizing this possibility as the best option so that the human life will be preserved in the best possible way. So for this matter, we started daily Zoom sessions to educate the healthcare authorities, political leaders, and the ordinary human beings around the world. And we are on a huge success in motivating so many homeopathic doctors and organizations around the world in so many countries. And today we are having the uninterrupted 292nd session. And we are conducting discussions in recent past with the same topic, what needs to be done to make homeopathy the #1 medicine in the world. The purpose of conducting discussions on the same topic is to initiate such a thought process in the hearts and minds of the people connected to homeopathy, especially the homeopathic doctors who need to make this process of bringing homeopathy available to the nook and corner of the world, to every citizen in every country in the world, to make it possible. For that purpose, we need to do a giant job. So these discussions are not only to share their opinions among homeopathic doctors from around the world, and also to initiate such a thought in every homeopathy around the world also. So today we have a group of panelists, homeopathic doctors from 3 different countries: Dr. Kumar from India, Dr. Muhammad Jamil from Pakistan, and Dr. Raman Unsweta Hoffman from Colombia. So we welcome you all and we call you one by one, and you will have 10 minutes, maximum 12 to 13 minutes to share your ideas. And after that, we will be having a panel group discussion incorporating the ideas of participants also. So first I will call upon Dr. Muhammad Jamil Akhtar from Pakistan, who is practicing homeopathy since last 12 years, instructor, clinical assistant, trained at Vocational Training Institute, Government of Punjab, Pakistan, and a member of PHF in Pakistan. I think PHF is Pakistan Homeopathic Federation. So welcoming you, Dr. Jamil. You have the next 10 minutes to present your ideas. So over to you, doctor. Please proceed.
Thank you, Ji. Bismillahirrahmanirrahim. Hello, everyone. Good evening to all of you. First of all, I would like to say thank you to Dr. Shaji and Dr. Manoj sir and the entire team of IFPH, International Forum for Promoting Homeopathic, to appeal all the homeopaths across the world for letting them gathered under the shadow of an umbrella. Here I am quite grateful to my honorable mentors, Dr. Javed Akhtar, founder member of PHF Pakistan, and Dr. Tamzila Khalik, who polished me in homeopathy and make me able to talk about homeopathy at international forum. The main purpose of today's unique meeting is to find out the ways to promote homeopathy, and this is only possible in the light of the teachings of our great Master Honeyman. Master Honeyman, Master Honeyman says in his second aphorism, the highest ideal of cure is rapid, gentle, and permanent restoration of the health or removal and annihilation of the disease in its whole extent, in the shortest, most reliable, and most harmless way on easily comprehensible principles. When we think about this aphorism, the main question is how the Master Honeyman's rapid, gentle, and permanent restoration of health is possible. How we can chase this goal? The answer is we must first be aware of are some shortcomings or some short are some shortcomings or are some drawbacks. Here I would like to share or mention some of the shortcomings which are as listed. The first thing, we do not have evidence based clinical data of our patients with us. For example, in 2011 in Pakistan, when there is a huge outbreak of dengue epidemic, at that time, a lot of homeopaths treated the dengue patients and cured them such a gentle and smooth way. But unfortunately, we sadly say there is no pictorial evidence or research-based data is available with us. Secondly, in 2017, when the subcontinent like India and Pakistan were facing together the problem of respiratory issues due to first condition of smoke. Here, homeopaths again come at the front foot and again treated such patients. But unfortunately, we can say that they could not able to collect sufficient data. Even at present, in the most evil situation of COVID-19, this is very good for us for homeopathy system that a lot of homeopaths treated the COVID-19 patients very well, rapid and permanent, and gave them permanent cure. But again, unfortunately, we can say that there is again no sufficient data, sufficient clinical evidence-based data with us. So this is a large, topic we are facing with. At the other hand, one thing is more. This is the era of high digital marketing, because we are now living in scientific era, and this is an era of high digital marketing, but there is also less awareness for digital marketing among homeopaths, especially in rural areas, because there are some problems like there is no proper internet facilitation is available, and there is not proper digital tools is available with there. So there is less awareness of digital marketing in that areas. For example, pictorial data of patients is not taken for public awareness. Even homeopaths of these areas, like rural areas, are not taking a proper advantage of social media as a digital market, because nowadays social media is a huge digital market. One thing is more, the very important thing जो है, the very important thing is violation, a huge violation of fundamental laws of our homeopathic system, like organon. uh, when we this is we knows very well that if there is a, violation of laws, it leads to the accidents, and if and the accidents leads the system to the destruction. Then if we still remain on the violation of laws, it will destructed in near future. These were some of the drawbacks of homeopathic system. At the end, I would like to wind up my topic by giving some views that how we can made our homeopathy the number one medicine in the world. First of all, we should follow our basic fundamental laws of homeopathic, like homeopathic organon. If we do not follow this, then we cannot avoid by the violation, and we cannot save the homeopathic. If we want to survival of a homeopathic system, then we must follow the fundamental laws of homeopathy. The other thing is, we should maintain our sufficient data, like pictorial data, videos data, audios data of our patient before the treatment and post treatment, so that we can present it at any platform if needed. At the and the other main and important thing, we should aware the knowledge of Kant observation. The Kant observation is very important to understanding the prognosis of diseases during treatment of a patient. And we also aware the prognosis of diseases of the patient, so that we could be able to chase our goal of rapid, gentle, and permanent restoration of health, which is said by great master Hahnemann. At the end, we must adopt any one of the following authentic prescribing methods, like first of all, in this method, first of all, we all should aware and we all should get the knowledge of repertory, because repertory is a basic knowledge, and is a very necessary tool to boost up the homeopathy as well as the homeopaths. So here some of the prescribing method which are in homeopathy. One of them is classical method, the other is pathological prescribing method, Segel mind method, theory of acutes by Dr. Profal Vijayakar, sensational method by Dr. Rajan Sankran, and many other prescribing methods which are in homeopathy. We should must follow one of them for our best prescription. Once again, thank you, Shaji, and thank you to all of you.
Thank you, Dr. Mohammed Jamil Akhtar. Now we move on to the next panelist from India, Dr. R. Reggikumar. Dr. Reggikumar.
Good evening, Dr. Shaji.
Yeah. Dr. Reggikumar is present there. So Dr. Reggie Kumar is the State Nodal Officer, the Quality Assurance Department of Homeopathy, Government of Kerala, Accessor, NABH Ayush Quality Council of India, External Quality Assessor, Public Health Facilities, National Health Mission, Government of India, and member, State Level Ethical Committee for Clinical Research, Department of Health and Family Welfare, Government of Kerala, former State Program Manager, Homeopathy, National Ayush Mission, Government of Kerala, and former State Program Manager, Ayush, National Rural Health Mission, Government of Kerala from India. So Dr. Raji Kumar is an important person from the state of Kerala, where the hub of homeopathy today in the world, who is involved in the department of homeopathy in very important key positions, who has very important role to play regarding homeopathy in the pandemic and in many other areas. Over to you, Dr. Rajikumar, to present your ideas.
Thank you, Dr. Shaji.
Yeah.
Shall I share my screen for the time?
Yeah, please.
So, a very warm good morning, good afternoon, good evening, wherever in your respective locations. I am very happy to be a part of this international platform, International Forum for Promoting Homeopathy. And I have been watching the programs done from the beginning, say day one onwards, because homeopathy was facing criticisms and there was a sudden turning point wherein this platform was formed and so much high profile intellects were poured in and lot of activities are going on. So I'm happy once again to be associated with this platform. And in fact, my acquaintance with, I should say, with Dr. Shaji actually started with a small book, which actually I have read during my post-graduation period. Actually, I was a regular visitor during at that time with British Library of Trivandrum. And one fine morning when I was there, I saw a book, and it was a book dedicated for the development of homeopathy. And when I saw the author, I am happy that it's an author from Trivandrum Government Homeopathic Medical College. And I think the introduction or forward was written by the then head of medicine, practice of medicine, Dr. Savish. So my acquaintance actually began with Dr. Shaji in that manner, and I'm happy now that he is always focusing his time and energy for the well-being of this platform as well as for the well-being of homeopathy. Now, my co-panelist, Dr. Akhtar, has actually touched upon many vital areas on what should be done and what should not be done. So, my intention here will be limited to throw some light on what is happening in Kerala and what are the replicable models that can be practiced elsewhere to make homeopathy the best system of medicine or homeopathy the number one medicine in the world. My acknowledgements are due to my homeopathic director, my deputy director, my DMO, and of course, Dr. Shaji Varghese, I have mentioned, and Dr. Manoj sir, who has been an inspiration to me all the time, starting from my graduation period. And humble pranams to Pioneer as well as other contemporary and great homeopaths who has actually nurtured homeopathy to the from the level of a small sapling to this giant big tree which is spreading its branches across the nation and across the globe, uh, especially in these times of difficulty and adversity. So, my fundamental point will be based upon these 2 points. Homeopathy is, in fact, a poem of poems. What we can say, it is a positive outlook enhancing mechanism. It is actually a patient oriented energy medicine. So, it is a poem of poem carved out of the bedrocks of inductive philosophy. That is actually the strong foundation of homeopathy. And Whenever we think of homeopathy and whenever we want to improve upon homeopathy, we need to focus on four fundamental aspects of homeopathy, or rather facets of homeopathy, which is common to any particular medical system across the globe. First and foremost thing will be our innovation, or our um, revisiting of our academic area. So academics, as you all know, is a huge area which actually forms the foundation of any medical system. We all know that we are studying more subjects than any conventional medical graduates, and we are spending more time with patients. We are listening to their sufferings. We are actually sympathetic, rather empathetic to their sufferings, so that we can have a lending hand, we can actually help them. Now, coming to the second thing, of course, clinical practice, we all know that we are giants in our own fields. But when it comes to documentation, or rather validation of the data, we are actually lagging behind. So, academics followed by clinical practice with standardized treatment protocol will be our second criteria, or second facet for development. And of course, third thing and most vital thing, which I think Dr. Shaji and his friends are doing right now, is the entrepreneurship development in terms of homeopathy. Because as a homeopathic graduate, or as a budding homeopath coming out of a homeopathic institution, we want to assess whether these young talents, they are actually capable of doing their business. Why we are calling it as business? Business is a noble profession by the concept of Dr. Samuel Hahnemann. It is a calling, as mentioned by Dr. Wesselhoff. It is a supreme privilege, a carefully chosen task wherein you are actually doing social service. But that doesn't end here. You need to propagate your system, you need to market your system, you need to identify the strengths, weakness, opportunities, as well as challenges of this system, what we call by the term SWOC analysis, SWOC analysis. So, in this aspect, with respect to entrepreneurship development, we need to focus much. If homeopathy has to be the number one system in the next millennium or in the coming years, we need to understand that the base of homeopathy in terms of turnover, especially in terms of business turnover, in terms of employment generation, in terms of capacity building, in terms of reaching to the outreach, in reaching to the remotest part, all these things will definitely will make a point. And fourth and most important thing is the R&D aspect of homeopathy, that is the research and development. So we are having a very good backbone of research councils. We have isolated research going on across the globe. We have very good works being published in our journals. But are we focusing on the right track in terms of research? Whether it is fundamental research, whether it is clinical research, or whether it is collaborative research. So we need to revisit areas where we can actually help our system to be the number one. With those opening few remarks, I'll just quickly go to the prospects in Kerala and which can be replicated. You all know that legal support has been a stumbling point in terms of homeopathy, especially during COVID times. And IFPH was the first forum I can understand that came up for a legal step to get homeopathy recognized in terms of not only in terms of prevention but also in the management. So there are support coming in the form of financial support as well, from whether it is from the government with respect to the homeopathic prevention aspect as well as the post-COVID aspect. Now, resilience is one term which we have to study from the Kerala model and which we have to use in our homeopathic potential, because over the last 200 to 220 years, homeopathy has been facing criticism, as you all know, from the beginning of the anti-organon published by Dr. Hecker when Dr. Samuel Hahnemann published his masterpiece. So, whenever this criticism was going, homeopathy was growing in leap and bounds on the other side. So parallel to the criticisms we were developing. So that's why we always say that whether it is a COVID pandemic, whether it is a huge inflow of criticisms. Criticisms always make you achieve better heights, and that's what Kerala's model also gives you as an example. So homeopathy in Kerala, I'm just keeping the introductory part, but I have to focus something regarding the innovations that is happening in Kerala. See, Kerala healthcare, especially in terms of homeopathy, has a very good network that is very important. We are having a parallel network just like conventional medicine and just like Indian systems of medicine. So that is actually the strength, and this thing forming a fundamental mm, framework within the system, collaborating within the system will be the best replicable model, whether it is in any state of India or in any country other than India. So we are having a very good network of institutions as well. You all know we are having almost 1,160 institutions across the state in this small state. So just like the density of the state is high, we are having a density of homeopathic institutions as well as homeopathic practitioners also. This again is also another aspect we have to think when we are trying to replicate, because definitely only with a very good network of physicians and network of systems, any medical system can flourish in any part of the world. And this thing I wanted to bring your attention that just like conventional medicine is having its primary care, secondary care, and tertiary care facilities, definitely the same thing is happening with homeopathy as well. But this point you need to go through in detail, because what is the output when compared to the input? The fund that we are getting, if you go across the figures, you will find that it is less than 3%. Nowadays, it's still reducing. But what is the patient footfall? You have to understand that we have got almost 25% of patient share with this less than 3% of input. So this input output relationship actually takes you to the efficacy part of homeopathy. Not only homeopathy is effective, but it is also efficient. So that's the importance of homeopathy, especially in this part of the world. And we need to have a life cycle approach whenever we think of the development of any system. Homeopathy, as a vision by Hahnemann, has had a very good strategy. But are we able to follow that actual strategy in the development of the system? Whether we were able to assess what is lacking in our system or what is happening in our system, whether we were able to identify that what should be our position, say in the next decade or maybe in the next couple of years, what should be our approach and what are the sourcing, whether it is with respect to human resource, whether it is respect to legal support, financial support, and also the documentation, the communication, the technology support, all these things, especially when we talk about technology, implementation of a strong technology system is the backbone of success of any medical system hereafter, because unless we are focusing on the implementation of IT system or technology, we won't be able to sustain, or we won't be able to make an actual sustainable development in terms of homeopathy. We need to have a life cycle approach that can only be supported by a strong project management unit. See, PMU is a broad term, but what we actually mention is IFPH can be considered as a PMU when wherein a lot of visionaries are coming, whether it is from the homeopathic uh, doctor side, whether it is from the public side, lot of doctors as well as public are coming. So this sort of integration will help to overcome the change resistance. Every time there will be resistance to change, resistance to adopt homeopathy, especially because of some lack of knowledge, some lack of skills, some lack of attitude. But these are things which can be overcome by suitable communication. Barriers of communication can be cut and we can reach the masses. So we should have a vision for standardized management. We should be focusing on helping the marginalized rather than helping the mainstream person. So we have to focus on giving equitable access to the healthcare. We have to focus on standardizing. And these are some examples of what we are having in our homeopathic sector, especially in Kerala. We are having a lot of projects. Due to time constraints, I am not going into the details, but just to tell you that we were intervening in every nook and corner of the state, especially in terms of any disaster, whether it is flood, whether it is landslide, whether it is any disaster, including this pandemic. And we were doing some telecounseling as well as telephonic consultation as well. We are having a lot of projects aimed at non-communicable diseases, de-addiction, transgender community, tribal mobile medical unit, floating dispensary, all these things. And we are floating all the data in a MIS platform also. This thing I want to highlight that for the development of system across the world, just like what we mentioned earlier, IT enabled system, there should be an MIS platform, management information system, without which we won't be able to identify whether we are progressing in the right way or we are doing a negative progress. So these are just figures which tell you that not only homeopathy is effective for children, but also it is effective for almost 74% of adults. So these figures actually help you also remove the misconception from the minds of the people that homeopathy is still not a system especially suited for children, but it's also suited for adult as well as persons of any age and any gender. These are the activities that, so this thing I want to highlight. What are our challenges, that is with in terms of public awareness, in terms of quality assurance, R&D, resource crunch, and what are our opportunities? Definitely you all will agree that homeopathy has got much acclaim, especially during COVID pandemic, because of the infinite potentials homeopathy can offer, not only in terms of prophylaxis but also in terms of limiting the illness which is coming just like a storm, as Dr. Haniman mentioned, in the acute cases. And in many cases, we were able to prevent ICU deaths, or rather, persons going to ICUs. So, these areas we need to identify, we need to modernize, we need to standardize, we need to validate, and we need to develop our infrastructure. So, these are the studies which are helping us, and we were doing a lot of studies in our state as well. Now we are focusing on another study that is going on right now in Kerala. You all may be knowing that Kerala has around 3.46 crore people, and we were able to give preventive medicine to almost 54 percentage. It might have reached 60 percentage in the second wave. And IFPH has been doing this effective work of coordinating the same thing right from the day one itself. And we are now focusing on a homeopathic survey that will actually improve the public understanding whether homeopathy is working or not, as well as we'll be having a survey on the post-COVID as well as the COVID management scenario as well. That's all I think for the time being, and I'll just move on to the last slide and say thank you to one and all. Whatever you do, you document, and whatever you document, start doing this. This is what Dr. Haniman has also mentioned. Whatever is written in the organelle, no sentence can be left unpracticed. Every sentence can be turned into practice, and everything that you can practice, you can still continue documentation. And quality is a journey, and it is not a destination. Continue your continuous quality improvement, and you will reach heights. Of course, these figures take homeopathic interventions in terms of social initiatives, just like in the World Environment Day. And also, this figure shows 100% distribution of homeopathic preventive medicine in a local self-government. That's my local self-government. So almost all governments are giving support. Even the panchayat president or the chief of the village is himself going and distributing medicines to people. So that's how community participation has evolved, and these are replicable models. And over to the my co-panelists for further presentation and discussion. Thank you, one and all.
Thank you, Dr. Rajikumar. It is very important to note that just by receiving less than 3% of the investment by the government in homeopathy sector, homeopathy is serving more than 25% of the sick people of Kerala is a very important information for the world community to realize, and the governments around the world to realize. 3%, less than 3% investment serving 25% of the sick people population. So it is very important. Next, I invite Dr. Raman Unsweta from Colombia. Dr. Raman, yes.
Thank you, Dr.
So,
Shadi.
yeah, Dr. Raman is a doctor and surgeon, specialist in family medicine, Universidad del Valle, diploma in homeopathy from the International Academy of Classical Homeopathy of Greece under Professor George Vidolkas, professor of homeopathy at the Department of Family Medicine, Pontificia Universidad Javeriana de Cali, Colombia, professor and collaborator of the Vidolkas Academy, Greece, coordinator of the e-learning diploma for Colombia. Over to you, Dr. Raman.
Thank you very much. Thank you.
Yeah.
Very good. How are
Please
you?
proceed.
Okay. Hello, everyone.
Your
Dr.
voice
Shadi.
is little not properly heard. Is there any?
Are you listening okay?
Yeah, your sound is little rough, or it is originally like that, or it is a technical problem.
Let's try.
Okay, proceed, doctor. Proceed.
Okay, thank you. Hello, everyone. Cordial greetings to my fellow and panelists. And it's great to see the good impact of primary care homeopathic programs working in this great way. Thank you for Dr. Retikuma for sharing with us this fantastic program. I want to share my screen. So here we are. Okay. The question is, what needs to be done to make homeopathy in the #1 medicine in the world? Okay, someone has told me that there is not good my sound.
Yeah, there is
Hello?
some little technical problem. I think that is because of the connectivity or something. Yes.
Okay. Let's start with this post. It's a report about the use of homeopathy in the United States and implications for public health. I didn't have any other. The question is, isn't classic homeopathy already the first medical system? Do we want to be in homeopathy to be one that attends the largest volume of patients, or let homeopathy continues to be the best healing medical method that also allows the mental, emotional, physical freedom of its patients? We will see the answer of those three questions later. First, let's see how are working traditional health systems. And the WHO defines the health system as the sum of all the organizations, institutions, and resources whose main objective is to improve health. A health system needs staff, funding, information, supplies, transportation, communications, as well as general guidance and direction. So, according to the WHO figures in the Universal Health Coverage Resolution last year, 2020, they show a great inequity in the provision of health services to the most needed people. And let's see some of these official figures they showed last year to us. For example, close to half of the world's population lacks comprehensive access to basic health services. Close to 100 million people are forced into extreme poverty because they have to pay for health services out of their own pockets. And more than 930 million people, about 12% of the world's population, spend at least 10% of their family budget to pay for health services. So, in this universal health coverage from the WHO, primary care health can provide medical care for 80 to 90% of the health needs of the populations throughout their life. There is a mismatch of 18 million professionals between the current health workforce worldwide and the one that would be needed today to ensure universal health coverage. That's very important because there's this lack of professionals in health. It's important because we can fill those vacancies with homeopathic medical doctors. The World Health Organization said in its writings that universal health coverage implies that all people and communities receive the health services they need without having to go through financial hardships to pay for them. It covers the entire spectrum of quality, essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. But the intention is good, but it contrasts sharply with the reality. Why? Because the provision of these services requires adequate and complete health and care personnel, and we saw there's a lack of 18 million medical doctors who are endowed with an optimal combination of skills and knowledge in health establishments, community proximity services, equity and opportunity services, and are equitably distributed, receive adequate support, and enjoy a decent job. But this has not been achieved in the last 70 years. There are two interesting strategies that finally the poorest end up allocating their scarce resources to cover their health and illness expenses, which ends up making them even poorer and also suffering from hunger. So there are three easy recognized basic healthcare systems in the world. The public assistance that 49% of the world population had, like poor countries, it means an universal coverage. Health insurance and national health systems that had the rest 50% of the population, world population, and means more than rich and industrialized countries. There are some restrictions for allopathic health systems. For example, these systems are in use since World War II. It has proven year after year that public health goals cannot be met. It is very expensive and doubtful results. And the problem with side effects of drugs, there are 180,000 deaths a year because of that. 1 million people injured because of side effects in the USA alone. And that costs from 70,000 to 180,000 million dollars yearly. So this drug-related morbidity and mortality is preventable. And how can we do that? With homeopathy, of course. And in homeopathy, we have the legacy of our master, Samuel Hahnemann, who circa 250 years ago raised a medical specialty based on a series of principles that later in allopathy medicine would be partially adopted. And these principles are the scientific method, that it is an organized and methodical support of observation, experimentation, data collection, and analysis of this for scientific purposes, on which a whole medical system of clinical care is based. The definition of the levels of the human being in mental, emotional, and physical, determining the principle of uniqueness of each case, which defines both the therapeutic approach and the monitoring of the patient under the homeopathic method. Two more important things from the legacy of Hahnemann's: the creation of a pharmaceutical system, special design according to the nature of the human being, distinct for the perfect and unique prescription for each sick individual. This allows the economic preparation of remedies, the quick and easy access to all economic and social strata of non-toxic remedy that have a curative intention or purpose. And of course, the description of infection disease, the miasmas, contagious microbes, management of epidemics, which in their time made the allopathic establishment to shame due to the therapeutic results of homeopathy against them. The preventive results of contagion and reduction of morbidity and mortality, which even today have not been overcome by the chemical medicine. Defined how lifestyle causes diseases and chronic health conditions, and the importance of education and empowerment of the patient in their health recovery process. All of those, Samuel Hahnemann's legacy. And finally, in his book, Organ of the Art of Healing, he left his legacy for the future generations. He meticulously and methodically determines all the academic and scientific processes that serve as the basis for the strict study of classical homeopathy. And finally, of course, the law of the similars, those symptoms that a substance is able to cause to appear in a person when exposed to it, that same substance also has the ability to cure those same symptoms in a person where they occur naturally as part of a disease process. So there is only one remedy that covers the current condition of the patient, and only the most similar remedy should be administered. When the symptoms change, the case will have to be reconsidered to give the patient another medicine similar to the new morbid state. And from the legacy of the homeopathic method, we have, for example, the homeopathic management of epidemics since more than 200 years ago. And Dr. Andreas Saine from Germany showed us at the Liga Congress in Leipzig in 2017 His work, Homeopathy in Times of Epidemics, is a fantastic presentation. And he reviewed more than 10,000 of homeopathic literature on epidemics and 28,000 volumes and references. And finally, the main finding is that the results obtained by homeopathy during epidemics consistently reveal an extremely low mortality rate. The legacy of homeopathy method in public health is a low homeopathic patient's mortality rate. Is always superior to the results obtained not only by the orthodox medicine practiced 1 century ago, but as a rule by the orthodox medicine of today as well. The World Homeopathic Organization had shown more than 40 publications directly recommending homeopathy to different governments around the world. The European Parliament showed us more than 17 guidelines and resolutions supporting homeopathy. The European Union had published 12 resolutions and recommendations to strategies for homeopathy in medical care system. In the United States, we have thousands of publications, studies, and recommendations, wide official acceptance. Those you can check them at the web page of the National Institute of Health. In the United Kingdom, there are more of 35 parliamentary resolutions in favor of homeopathy in the health system. In Germany, Switzerland, Japan, Australia, India, homeopathy is in the official health system. And here in Colombia and South America, Brazil, Argentina, and North America, Mexico, Canada, and United States, homeopathy is part of the national public health system. It's teaching it at the university level, and there are outpatient clinics where classical homeopathy is consulted. In conclusions, from now to the near future, homeopathy can remain #1 only if all of us commit ourselves to guaranteeing the training of new generations of homeopathic physicians within the highest academic and scientific standards. We cannot allow the training of mediocre practitioners who end up discrediting homeopathy. We must prevent so-called homeopathic practitioners from publishing ridiculous unscientific theories in the name of homeopathy. Such irresponsible and unprincipled publications do more harm to this beautiful medical system than any criticism from uninformed journalists. And my final conclusion is that the excellence of academic training, responsibility in patient care, the correct preparation of homeopathic remedies, and complying with Hahnemannian principles is what will keep us the first level of medical care methods. Thank you very much.
Thank you, Dr. Raman. It's nice presentation. Your conclusion was excellent. The development of an academically competent homeopathic doctors around the world is the most important necessity to bring homeopathy to the higher level is a very important message. And now I invite a discussion session. Those who wish to participate in the discussion, please come to the go to the panelist list and raise your hand so that the questions can be asked or comments can be made. So I invite Dr. Dr. Manoj to ask your question.
Thank you, Dr. Shaji Kudia, for giving an opportunity. Well, sir, not regarding questions, but participating discussion is an important thing, I think. Well, Dr. Rajiv Kumar really gave the message of the world through that particular statement that with the 3%, less than 3% of allocation, we are providing healthcare for 25% of population. That too, a state like Kerala is the real message of the IFP to the world. In fact, this message will really send shock waves to the opponent camps. So my appeal is to those who are participating from other nations. You should give this message to the world and your political leaders and the parliaments. Very good suggestions by Dr. Ravi Kumar. Absolutely a professional presentation, 100% of professional on. That was a nice discussions. Then Dr. Anseta Ramon also nicely presented regarding the statistics and the suggestions to present homeopathy, how it becomes the world #1 medicine in world. Definitely it's a nice presentation. Then Dr. Muhammad Jamal also too presented regarding the digital marketing of homeopathy, then evidence-based clinical trials. Very good, nice suggestions too. So thank you for your participation, and I request all of you to participate regularly in our Zoom platform. Thank you.
Thank you, Dr. Manoj.
Thank you, Dr. Manoj. Now it is Dr. Lokmani Gupta. Dr.
Hello.
Lokman. Yes.
Hello. Good evening to all. A very nice meet to hear Sikh, Pakistan, Indian, and Colombian scholar. All the three presented the beauty of homeopathy, origin of homeopathy, the socio-economic acceptance of homeopathy, the budget, how less budget we need to propagate our homeopathy amongst the suffering humanity, and the result very well described, very well said by Dr. Rajiramji. And from Colombia, that very well picked up the organ system. And the main thing which we got today, that not only in India, as we heard yesterday, it is not only in India, but in all the countries around the globe, homeopathy is getting very well accepted, WHO, UK, all over. But the main thing is that we should know the limitations of homeopathy, the limitations of homeopathy, where we can do up to what extent. Then secondly, we have to publicize our work among the general public so that they can accept it. Our leaders can accept the results of homeopathy, and we can become #1 in the world as homeopathic system of medicine. We need a strong work. We are doing a work. Thank you, IFPH, for arranging such nice session.
Thank you, Dr. Lokmani. Those who wish to ask questions or make comments, please go to the participant list, and there is a raise hand option. Please click there to call upon you to make your comments or questions. So since there is no raised hands as of now,
Naveed Iqbal Awan, please,
okay,
Pakistan.
okay. Naveed Iqbal, yeah, please proceed. Dr. Naveed Awan, yes. Please unmute from your side, Doc. Yes.
Yes. Thanks, Dr. Shajid, Dr. Manoj. Hi, everyone. Good evening to all. Very well, very good lectures, very good point of views presented by Mar and Dr. Raman. I appreciate all of you who delivers a very informative lectures today in the session. How we can promote the homeopathy, how we can progress the homeopathy, how we can proceed the homeopathy. Number one, first of all, I appreciate Dr. Rish Kumar. His lecture was very motivational and encouraging lectures for all of us. Dr. Shaji mentioned here that the government is only spending 3% on the homeopathy, while the result, while the output from there is for homeopathy is 25%. Very excellent, very encouraging. So, what is there? What we can do? How we can proceed? That depends upon us. That depends upon our skills, educational skills. That depends upon our clinical skills. That how we can promote ourselves, how we can make the develop confidence of the peoples towards the homeopathy. So if we have a good practice, good clinical practice, if we have good knowledge, if we have the good treatment skills, then the peoples will have the good confidence over the homeopathy. More people will be attracted towards the homeopathy. Like I appreciate Kerala state, where there is a comparison of the homeopathic versus allopathic. Same here in Pakistan. I think last 5-6 years, there was the very small homeopaths jobs in the government hospitals, but now the jobs for homeopathic doctors are created there. A lot of homeopathic dispensaries are working there. Even in a city, in a villages where the 2, 3, 4, or 6 allopathic doctors are there, then I think there are 20, 25 homeopathic doctors are also there. So it is the very encouraging point. Then when we with the allopathic system, we with the government systems, promoting the health facilities to the all persons throughout the country. Now, what we can do? That is the important point. Dr. Jameel Akhtar raised a good point that we should work on the social media. We should promote the digital marketing. Dr. Rish Kumar raised the good points. Dr. Rahman, all are, and I appreciate Dr. Shaji, who is the running this platform from the day one today. And today 292 sessions are gone.
Okay.
So these are sessions. Why these all sessions are running? These all sessions are raising the information, raising the points from all the homeopathic throughout the world, what we can do. Criticism always promote the systems. What are the fault in the systems? What are the weakness in the systems? Here we discuss all the weakness. We all discuss all the criticism over the systems. So it's
Okay.
up to us how we can remove that weakness. We can remove that faults. So thanks a lot. I'm here just to appreciate all the today presenters. Thanks, Dr. Shadi, and thanks all. Thanks.
Okay.
Thank you, Dr. Avan from Pakistan.
Thanks.
Now,
Beatrix, doctor.
yeah, Dr. Beatrice, and we will have it tomorrow is a Zoom session for our students wing where we will be explaining the action of homeopathic preventive medicine, how it is working, and also what is going with the current vaccination, COVID vaccine program around the world. we will be making a comparative study of that. Those who interested can go to our groups and see the timings, and the same link can be used to attend the session at 2:30 p.m. in the afternoon tomorrow. And now I invite Dr. Beatrice Jessner from Germany to say her comments and or ask her questions, and also to say vote of thanks. Oh, sorry. I have to still give timing to the panelists to say their final words.
Yes.
So you can say your comments, Doctor. Dr. Beatrice.
Yes, thank you.
from
Thank you
Germany.
very much, Dr. Shai. Greetings to all the group and the panelists. And I can say today it was a very, very special session because Dr. Jamil from Pakistan was talking about Dr. Hahnemann in such a nice way. And I also always feel very touched here from Germany to be with you. And you're talking in such a great respect. And I would like to say that the second paragraph of the Organon is so beautiful. We could read it every day in our practice because it's so well written. And I really appreciate Dr. Jamel saying that it's so important to have the fundamental tools and to use them. The principle of homeopathy and like the repertory, it's a very important tool, and to be really proper in our work. And Dr. Ray Kumar, it was very, very great, all your presentation, and also pointing out that the studies and the documentation will be so important. And today, and also Dr. Ramon telling that it's such a beautiful medicine also for the for the people worldwide who need medical care, for the poor people who don't have so much money. And today I got the idea to promote homeopathy. We should look at the principles of Dr. Hahnemann. And one of his main principles, if you know the history in that times, he was the first one who was writing every sentence of the patient. It was like every patient was so important for him, and to observe the truth. So documentation was a great, great and very special way he was doing. Secondly, from the part of character, Dr. Hahnemann, he was so honest. He always said, we have to observe. Don't make up your mind. We have to observe. And what we observe, we have to be honest and share with the others. And as you also said, Dr. Ramon from Cologne, for him, the worst thing were the the doctors treating with homeopathy in a mediocre way or in a bad way. These people are the biggest enemies for homeopathy. He also said this. So my idea also is that we perhaps we should look at the life and also at the character of our master and promote homeopathy in his way. And all three of you today did it in an excellent way. I feel this. So I can say I'm very touched for all your love you have also for homeopathy, and to try to understand this very special way of treating, which was developed by Dr. Hahnemann. And we can say that he was a person with a great, great heart.
Thank you, Dr. Beatrice. Now I go to the conclusive session of giving 1 minute or 2 minutes each for each panelist to say your final conclusive words for today's session. So I invite Dr. Muhammad Jamil from Pakistan to make your conclusive statement.
Yeah, thank you, Dr. Shaji. Again, thank you. I would like to say again that we should follow our fundamental laws and our basic tools to promote ourselves and to promote our system like homeopathy system. Thank you.
Thank you. Dr. Reji Kumar, please unmute yourself and make your statement, please.
It was a fantastic discussion indeed, Dr. Shaji and my dear panelists, Dr. Jamil Akhtar and Dr. Raman Hoffman. See, 3 points I'll reiterate once again. First, we have to revisit our academics. Our academics should be in parallel with the practice that is envisioned. Second thing, we have to integrate the upcoming technologies, the upcoming developments into our system, not into our materia medica, but in terms of our management aspect, how far we can strengthen our auxiliary management. And third thing, what I will always tell is the quality assurance in terms of case taking, quality assurance in terms of prescription, quality assurance in terms of dispensing, quality assurance in terms of our awareness program. So these three things I think will definitely make a change for the years to follow. Thank you.
Thank you, Dr. Reji Kumar. Now, Dr. Raman Unsweta Hoffman. Dr. Hoffman, yes.
Thank you. Definitely, we know that in general, homeopathy is very well accepted in academic circles. Is fantastic, well accepted by our patients. We need, as Dr. Beatrix said, we have those excellent instruments, the organon and our preparation, our training to help people. And we are in a very important times, historic times. The place is prepared for receive homeopathy. There's a lack of a lot of things, academic things, results in treatments, and we really need more homeopaths that have a relationship with authorities to put inside homeopathy in the public services around the world. Here in Colombia, in South America, we do not have those problems that you have in Europe, for example. You are fighting against media, against other colleagues. Here in South America, there's a very good acceptance of homeopathy. But I think it's important to share more those experiences and made more public our results. Thank you, Dr. Sajin.
Thank you, Dr. Hoffman. And so it is the time to wind up. I request once again Dr. Beatrice Jesner to come forward and say a word of thanks on behalf of IFPH. Please, Dr. Beatrice.
Okay, that's a surprise. Okay, I would like to say thank you to all the group, all the panelists, to Dr. Shai, to Dr. Manoj, all the people who are staying with us every day. And I would like to say thank you to Dr. Hahnemann, who created such a great therapy.
Sure.
Okay.
Sure. Thank you, Beatrice.
So thank you all on behalf of IFPH for participating today as a panelist and as a participant. Thank you all. Tomorrow again, we can meet with another session from Dr. Ileana Randasu, who will be talking on agrohomeopathy, who is conducting researches on agrohomeopathy, will be giving her presentation tomorrow. Invite you, all of you, to participate in the same session at the same time. And with this, I wind up today's session. Thank you all.